On March 11, 2020, when patient 0 was confirmed to have died due to complications related to the COVID-19 disease at the Georgetown Public Hospital Corporation, the entire medical facility was thrown into a state of shock, disbelief, and fear. A number of staff members, including doctors and nurses who may have been in contact with the index case, were placed in isolation while the management of the hospital hurriedly implemented the necessary precautionary measures to reduce the risk of staff becoming infected. The social work department, which is currently equipped with 12 social workers, sprang into action. Their initial role was critical. They had the Herculean task of assuaging the fears and anxieties of scores of staff members who were fighting to understand and cope with the sudden arrival of this unprecedented and potentially deadly disease, which had invaded their workspaces without warning. As the country marked the one-year observance of the outbreak of the disease on Thursday, Clayton Newman, social worker and coordinator acting, and Lancelyn Lawrence, assistant social worker for staff of the Georgetown Public Hospital, in an exclusive interview with Nightly News, reminisced on the hurdles faced by the institution during the disease onset.
Well, generally everyone was scared, like the entire nation. Persons were very concerned about becoming infected on the wards and then taking this home to their families.
As social distancing and other guidelines were imposed, the social work team continued its interaction with staff via telephone and ensured that care packages were provided where necessary. Newman pointed out that interventions were also channeled by the social workers to staff members who turned up at the triage area of the institution seeking treatment for the disease. A holistic approach was then undertaken to ensure that not only staff who tested positive for the virus, but also their family circle received the requisite counseling to better enable them to cope. Lauding the notable change in the mindset of hospital staff 1 year later, Newman attributed this to the continuous education and awareness outreaches which have been conducted.
After staff would actually become more educated, as in you can take your gongs, you can mask up, you can keep your distance, like HIV and TB post-pandemic, persons have become more comfortable.
He noted that Guyanese have learned how to coexist with the pandemic in as safe a manner as is humanly possible and have been more empathetic towards each other. The coordinator acting cautioned that persons who have lost their loved ones to COVID-19 should seek counseling immediately.
They should be counseled. I didn't lose anyone to COVID, but losing a loved one in general traumatizes you. Losing a loved one to the pandemic under a year, that's traumatic, and you definitely need counseling. I don't know if you understand the whole funeral, the dynamics in that burial is totally different.
Temika Rodney reporting for the HGP Nightly News.